And the type for cardiovascular exercise is obviously your aerobic large muscle groups. So walking, jogging, any type of aerobic exercise that you might do, taking an aerobic class. Yoga and Pilates I wouldn't consider necessarily cardiovascular exercise. That's more flexibility exercise. However, Pilates can cross over into some strength training as well as yoga can. Some of those poses for core strength training. Yeah?
Backing up a little bit, in intensity, your talk test, are you doing harm if you're doing more than if you, are you?
Is it hurting you more than
doing
helping you?
Yeah, more than being able to.
I don't know how much it's hurting you. I just don't think it's more beneficial for you. So if you're panting, you can't catch your breath, and you're getting to the point where you can't talk, you're not gaining any more benefit by doing that as if you were able to talk and needed to take. Obviously you don't want to be able to talk the entire time. If you're able to talk the entire time, you're probably not working quite so hard. But you want to be able to maybe talk a sentence and then take a little break to catch your breath and talk another sentence. If you have known cardiac disease, it can be more harmful for you. Or if you have risk factors, because that's where you get into the area that you could be developing arrhythmias because your heart can't handle working that hard. It's really important to work up to those intensities. My suggestion is to start lower, at the lower intensities, and slowly work yourself up to those higher intensities, because as your body adapts, what you initially thought was really hard is not going to be as hard for you. It's going to get easier with time. It's really the adaptability of it. So I wouldn't start that way. I would definitely start slower and work up to that. Does that answer your question?
Yes.
So strength training guidelines. So adults that are under 65, 2 to 3 days per week. Number of exercises, 8 to 10. Here's what I really like. When I was in college, you had to do 3 sets of 15, of 12 to 15 exercises. And I always thought, there is no way that I'm going to spend an hour and a half in a gym doing 3 sets of 15, of 12 to 15 exercises. It would take me 2 hours to do that. They found just as much benefit, if not more benefit, of doing 8 to 10 exercises, doing 1 set of 8 to 12 reps. So what does that mean? If you can do more than 8 to 12 reps, it's not hard enough for you. If you can do only 5 reps, it's too hard for you. So 8 to 12 repetitions, you're feeling like I need to stop. That's the intensity, that's how hard it needs to be for you. That's where you're going to gain your most benefit. They are showing that you're not gaining a whole lot more benefit from doing more sets than 1 set. You get just as much benefit. So older adults that are greater than 65 are those with chronic conditions. So if you're 50 to 64 with chronic conditions, could be diabetes, could be several risk factors, high blood pressure. Especially with high blood pressure, what's the number one thing you need to remember when you're doing strength training exercises? Breathe. What's going to happen if you hold your breath? It's going to shoot your blood pressure up even more. So really breathe, and we're going to go through some of those techniques when we're doing these exercises. You should be doing 2 to 3 days per week, again, 8 to 10 exercises, 1 set of 10 to 15 reps. I still say 8 to 12 reps, 8 to 15 reps is okay. So unless your physician is telling you for a specific reason, like really high blood pressure, he doesn't want you to do more, he wants you to do less weight and more repetitions. That would be, a call that he needs to make. But anywhere between 8 to 15, and you'll see with cardiovascular disease, that's what they recommend as well, 1 set of 8 to 15 reps. The big difference, and I don't care how old you are, I say that everybody should do this, but the recommendations is if you're over 65, you should do flexibility exercises at least 2 days a week. So that can be your stretching after your activity, your good cool down and then your stretching, or it can be yoga classes, that type of thing. But that's really going to help keep you moving throughout life. I say everybody should start it from the age 20. The difference between me when I was 20 and now I'm 37, I see a huge difference in my flexibility, and I stretch every day. So, it's really important to keep that trend up. So this is just another way of looking at intensity. So moderate intensity is that 8 to 15 reps. Somebody who's really going for strength, so the bodybuilders, those who really want to increase their muscle mass, they'll do the high intensity, less than 6 reps. I wouldn't encourage that for anybody. I mean, unless you really want to get into bodybuilding, it's not safe. That's not a safe thing to be doing. And endurance athletes, you'll see those who really want to work on their endurance will do greater than 15 reps. Doesn't build a whole lot of muscle mass. It might help sustain what you have, but it's not going to build muscle mass. And our goal is to sustain and build a little bit of muscle mass. So at the end of your exercise session, everybody should be doing a cool down. So 5 to 10 minutes of slow activity again. So if you walked and then you did some sort of resistive bands or strength training, you can walk again just at a slower pace. Just really cool yourself down. Let all of that lactic acid, everything that's built up, start to flush through your system. This will bring your heart rate, blood pressures down to normal. Again, this helps with things like fainting. Because what happens when you go to sit down after you've just worked out really hard, you get up and you feel a little bit dizzy. It's because your blood pressure, all the blood's pooled to your legs, and your blood pressure drops instantly. So when you cool down and you stretch, it actually helps redistribute the blood where it needs to go, to the working muscles, to the organs, so that you don't have that feeling of dizziness or that feeling of fainting. This also will help relieve muscle tension. It will help avoid muscle soreness the next day if you're stretching, and increase the range of motion.